Hello everyone, my name is Rivky Weiss, and I'm taking over OK Clarity's Instagram tonight to do a live on PMADS, Perinatal Mood and Anxiety Disorders. We're going to be doing this in a question and answer format based on questions that followers have previously sent in. This is a large topic with a lot to talk about, so I'm not sure that we're going to be able to get to everything tonight. In fact, I'm planning to do an additional live on this in a couple of weeks, so feel free to send in any questions which can be discussed in future lives. Most of you are familiar with the term postpartum depression, and I know that I called this live PMADS. PMADS stands for Perinatal Mood and Anxiety Disorders. While most people are familiar with the term postpartum depression, that's really just one factor of what PMADS is. In several ways, In several ways, the term postpartum depression doesn't cover everything. First of all, many people experience symptoms during pregnancy, and symptoms vary. PMADS is a more inclusive name, which includes anxiety, depression, OCD, psychosis, PTSD, panic disorders, and mood disorders such as bipolar. All of these disorders and mental health issues can be developed after birth. So PMADS are very common, and research shows that it can affect about 1 in 7 women. And even with it being so common, there are many doctors and even therapists that are not very familiar with it. So it's important to find somebody that's trained and knows what and understands the symptoms and knows what you're talking about. So when someone has a baby, there's a lot of changes, hormone fluctuations, and those can cause feelings of mood swings, sadness, feeling incompetent, and those are very often referred to as the baby blues. So what's the difference between the baby blues and PMADS? It's a very common question that people have, like, how do I know if I should be concerned? How do I know if this is something that's not going to go away on its own? So there's 2 main answers that differentiate baby blues from PMADS. The first one is timeline. Baby blues generally start between 2 to 3 days after birth, although they can start immediately, and last up to 2 weeks. Postpartum depression or PMADS generally hits about 4 weeks after birth and can last up to a year. It can also begin several months after birth, even 6 months later. The second way you can differentiate it is by severity. While baby blues generally cause irritability, fatigue, and sadness, postpartum depression and PMADS can cause more severe symptoms, including aggression, extreme stress, potentially feelings of detachment from a baby, or even psychosis. So we're going to be discussing now the main parts of PMADS and what they specifically look like in a perinatal or postnatal woman. So taking all that we know about depression, how is a woman with PMADS affected? What does that look like? So some of the symptoms that might come up is not feeling excited about the baby, not knowing how to take care of the baby, everything feels like a burden, feeling like her family would be better off without her, or some mothers feel like they don't deserve to have a baby, or other mothers would take better care of the baby. They feel like everyone else is managing better than they are. Perinatal or postpartum anxiety can look like concerns that feel very urgent. A mother has a hard time distracting herself from her concerns. She feels irritable. She can't sleep even when the baby sleeps, and she finds that she can't relax even when the baby is sleeping or is in the care of others, constantly anxious and worried about the baby. Postpartum OCD is usually focused on safety issues around the baby. Sometimes the concerns are if something will happen to the baby, and sometimes there are intrusive thoughts of what if the mother harms the baby. Now, these OCD thoughts are not actually dangerous to the baby because they're considered ego-dystonic, which means that they're against the values of the mother. They don't fit in with the mother's values. So even though a mother may have concerns such as, what if I drop my baby? Or what if something happens to the baby? We're not concerned that she's actually going to harm the baby. It's just very difficult for the mother to function. So one of the questions that often comes in is how to differentiate between postpartum OCD and then postpartum psychosis. Postpartum psychosis is very rare. It hits about 1 in about 1,000 women, but it can happen. And in postpartum psychosis, it's delusions, hallucinations, and sometimes lots of thoughts about harming yourself or the baby. And unfortunately, in postpartum psychosis, the mother is not aware that these thoughts are against her values and are against what she believes. Sometimes we unfortunately hear stories in the news of a mother who harmed her children, and generally it turns out, not always, but often it turns out that the mother was suffering from postpartum psychosis. Postpartum psychosis is generally considered an emergency and needs immediate care. Another thing that often arises during PMADS is intrusive thoughts. And these can be across all spectrums, but they're very distressing and often leaves the mother having a hard time caring for her children. Something else included in the PMADS is panic disorder, which can feel something like I'm dying and I can't take care of my baby, or I'm going crazy and losing control. It's usually involving caring for the baby. Something else that can arise in PMADS is PTSD. PTSD generally related to childbirth or other trauma associated with being pregnant or giving birth. So this can be related to pregnancy complications. PTSD sometimes happens when people have traumatic births. Sometimes it's vivid memories of giving birth or of the trauma and constant flashbacks. And unfortunately, what sometimes happens with postpartum PTSD is that, like with any PTSD, we try to avoid triggers. But sometimes the baby is a trigger, and that can lead to detachment from the baby. If seeing the baby triggers the mother, then in order to protect herself, she tries to detach from the baby. So what does a treatment plan look like? If somebody finds out they have PMADS or their doctor diagnoses them with it, or they go online, they research the symptoms, and they believe they have PMADS, what does the ideal treatment plan include? So there's really 4 parts to it. The first part is a thorough medical evaluation. Sometimes the way a new mother is feeling is due to other medical conditions, a thyroid imbalance, or something else. It's important to take a full medical evaluation and check off all of those boxes. Another part to it would be a psychiatric evaluation to check if medication is necessary. Medication is one of the important treatments of PMADS. It's not always necessary, but sometimes it is, and it brings immediate relief. The third part is psychotherapy, finding a therapist who's trained in PMADS and can work with you and understand what you're going through. And the fourth part is support groups. It's very important to have support during this vulnerable time. So these are 4 parts of a treatment plan that can be done. But then there's more things that people can do, that their family can help them do, that we can do for our friends. Because another question that comes in constantly is, what can I do if I think my friend or my sister or someone I know or care about has PMADS? How can I support her? So there's there's 4 basic things that we can do for ourselves or for someone else with PMADS. The first thing is normalize and destigmatize. So a lot of people suffering from PMADS will tell you that they felt very alone and they thought they were the only ones ever affected by this. We have all these ads on diapers, formulas, magazines of the mothers with the smiling babies, and you walk on the street and you see smiling mothers and babies, and it looks like everybody else is having an easy time. And this brings a lot of shame, and then people are way less likely to ask for help if they feel like they're the only ones, or they feel like it's embarrassing. So by normalizing, destigmatizing, and having a conversation about this, we bring awareness and we let people know that it's something that happens. 1 in 7 women is in fact a lot, which means that it really affects a lot of people. It's also important to notice that while PMADS does affect 1 in 7 people, severity of symptoms really varies. But if you bring together a group of women who've given birth, many of them can tell you about a time that they struggled after giving birth, especially if they've had multiple children. So normalizing, destigmatizing, opening a conversation is very important for people to get help and for people to know how to get treated. The second option is getting a good night's sleep. And new mothers, I know it's kind of counterintuitive to give birth, have a newborn baby who eats around the clock and needs to be held, fed, changed, and still try to get a good night's sleep. So it's a little tricky because sometimes not sleeping enough and not eating enough can actually trigger PMADS. So it can be caused by not enough sleep. Symptoms can also be worsened by not getting enough sleep. So it's very important to get enough sleep. And if possible, whatever that looks like, having family, friends, a spouse, somebody come help, hold the baby, making sure that a new mother is rested. Another important part is nutrition. Sometimes new mothers get overwhelmed with taking care of their babies. They don't really have energy to make themselves food or even the space to think about it or the time. It's difficult to prepare yourself meals when you're taking care of the baby, and sometimes you're still recovering from a birth, whether you had a C-section or a difficult birth or any birth. It takes time to get your strength back, your energy back, and to get back to yourself. But prioritizing sleep and healthy meals is very important and helps in recovery. The next thing that can help is exercise. Some mothers have an all or nothing approach, especially mothers that have PMADS, depression or anxiety. It's difficult for them to be able to recognize that every little bit that they do is helpful. And a new mother does not always have the ability to do an hour workout or go to the gym or whatever kind of exercise she's previously done. But even 10 minutes a day, sometimes with a stroller, of just going outside and light exercise can be very helpful. Obviously, with a doctor's permission. Postpartum, especially postpartum, we need a doctor to give the all clear, but even light exercise helps a person focus externally and helps them feel more in control. So exercise is very important. The last part that can really help is social support. And that can look like a support group or just a group of women that you can talk to, family, friends, or joining an organization. Common organizations that help with PMADS are Sparks in Brooklyn, Yad Rachel in Lakewood, and then Mothers of Crown Heights in Crown Heights. I'm not very familiar with all of these organizations, but I know that Sparks has a podcast where they interview various people talking about their experiences with PMADS, and that can be a valuable resource for anyone that feels alone and struggles and wants to get more, or just wants to get more information. I believe they also have some support groups. So there are also several questions that came in regarding PMADS. So I'm just going to read the first question out loud. As soon as I was born, my mom had postpartum depression symptoms. She refused medication. Things escalated very quickly. Family got split up. Parents ended up divorcing. Why would someone refuse medication if it means one could save their family from trauma? So that's a very good question. And I'm just going to give a general answer because I have no idea who sent this in or what the circumstances were. So first of all, sometimes people that have postpartum depression or PMADS actually do not know that they have PMADS. Very often it's people around them, their spouse, their family, even their doctor that recognizes it and lets them know that, like, you're not yourself. We notice that something is different. Sometimes it is a person themselves that says, I'm not myself. I've never felt this way before. But very often people are unaware of their symptoms. And if someone doesn't recognize that they have PMADS, then they would refuse medication. And I'm going to answer this question generally of why people refuse medication. So there's several reasons why people refuse medication. One of the reasons is shame or stigma, depending on the community or family they come from, their cultural values. There may a lot of times be a lot of negative stigma associated with taking medication. Sometimes it feels like you're not strong enough, you're not trying hard enough, and there are a lot of beliefs associated with that. Sometimes people don't take medication because of a previous bad experience. If someone had tried a medication and it made things worse, they may be reluctant to take it again. Or maybe they had a bad experience with a psychiatrist or a therapist, and that makes them reluctant to try again. Another reason why people may not want to take medication is because of costs. If it's not covered by insurance, it becomes expensive and it just doesn't feel doable for them. Another question that came in says, this is from a new mom. Any tips on not getting so nervous when something doesn't go my way? So we're all aware, and we've mentioned it a little bit, of how hormone fluctuations affect moods in new moms. And it's not only increased hormones, it's also the fluctuations that make it difficult to be regulated and sometimes to cope. So it's especially difficult when having a new baby and dealing with decreased sleep, just being busier, and it's just a little harder to cope. So while something like this would be a struggle always, it can be especially hard after having a new baby. So people that like to plan things out and like things to go a certain way, it gives them a sense of control, and that gives them a sense of security. For someone like that, it's difficult when things don't go the way they planned, especially as anyone that's ever had a baby before can tell you. It's difficult to keep a schedule. You think you can leave your house at 2 and you're not getting there. The baby needs to eat. The baby throws up. There's always something happening that derails your plans and makes it difficult for you to do what you plan to do. So there's some basic general tips of how this can be handled effectively. The first one is reflect on your reactions and notice them. Notice what happens when things don't go as planned. Do you get frustrated? Do you get sad? Do you get anxious? Are you scared? What happens? Noticing the feelings and naming them can help make it easier for you to manage your reaction. And understanding your triggers can also help. The second one is to work on flexibility. Sometimes when something doesn't go the way we planned, or we have an emergency, baby's not feeling well, baby threw up, we have to change our plans, we don't have a plan B. We could take a deep breath, try to ground ourselves, and try to think, is there another way I can make this happen? Is there another way I can manage? What are my options? What can I do? And that brings us to the next step, which is focus on solutions. And just trying to problem solve, brainstorm, is there another way that I can do this? Another important thing to do, which is important after having a baby, is recalibrate and reset our expectations. While we normally are able to do certain things, maybe we can make supper every night, maybe we can have laundry done, iron folded, clean house. Many women find after having a baby that they're not managing to do the same things they were able to do before. And that can be disappointing or sometimes make them feel inadequate or like they're not enough. But it's important to be kind to ourselves and to recognize that having a baby changes things and takes up a lot of our time and makes things that we used to do more difficult for us. So resetting our expectations of what we actually can accomplish can be helpful. The next thing is to seek support, is to reach out to any other new mothers or anyone else you know who's had a baby, who is a new mom or has been a new mom, and see, how did you handle it? How did you manage it? What kind of tips or tricks can you do? And if this is something that continues to bother and continue to have a difficult time with, then it might be time to seek therapy or professional help to help you with this. There's another important piece that was not an actual question, but I think it's important to mention, is that people that are struggling with PMADS or hormone fluctuations, sometimes when they go to their doctor, they ask for birth control and they're just given a prescription. And not all doctors are aware of how hormone fluctuations can affect somebody who already is at risk for PMADS or already has PMADS and can cause it to get worse. So it's important to have this discussion with your doctor, whether you're having the baby blues, have PMADS, have a family history of it, or are just concerned, to discuss what are these birth control pills or whatever it is, what is that going to do to me? Is it hormonal, and what are my options? So I'm just going to be ending this live now, and I'm going to be doing another live in a couple of weeks on OK Clarity. Feel free to send in any questions about PMADS that you have, anything that you want to hear more about, anything else you want to discuss more. Thank you for listening, and have a good night.